So my name is Philipp Wolf. I'm the founder and CEO of Custify. Custify is one of those customer success platforms Miranda mentioned before. We have typically SaaS businesses or mostly SaaS businesses to reduce their churn. And one of the things to do that is actually using health scores. And that's what my talk is today about. Like, what does it mean? Why do we need them? Let me first tell you a story about how we came actually up with the idea of Custify. Or the reason why we founded Custify in the first place. In our previous roles as a founder team, we had a lot of touch points with other SaaS founders and leadership teams, mostly around strategic discussions. Many of the times in those discussions, customer acquisition was coming up, and the teams, they had like large teams and budgets and sophisticated tools and everything. So basically the customer acquisition costs, they were known down to the cent and the channel and everything. And then when the question came up, so what do you do once these leads all became customers to you? What do you do with them? Yeah, we sent them a newsletter. Yeah, we have some guidance for them, but yeah, we don't know exactly, right? We measure churn. That was actually a long time ago, the trigger for us to look into this topic of customer success. Me personally, I didn't even know the term customer success back then because I was more in the product area. However, yeah, one of the things to practice customer success is certainly those health scores. And that's what I would like to talk a little bit more about today. Now, let's dive into it. So why do you need health scores at all, and what is that thing? So the definition of a health score basically is it's a metric that helps you to assess the relationship with a particular customer, like on a very broad scale. And they can help you, these health scores can help you because, yeah, you can typically reduce churn. You can improve your retention with them, meaning you understand which customer needs your help most. Typically, the situation is that you have, more customers than a customer success manager can handle. So you want to know which customer needs your help most, and you want to typically a tool telling you that, or ideally a tool telling you that, so you don't waste your time in crunching the data and then finding out that you were talking to a customer who's actually perfectly fine and using your product as they should. It of course boosts customer acquisition as well on a long term. Why? Because yeah, this strategy of getting proactive with customers and helping them when they need your help most means also that you will probably result in a lot of more happy customers that use your product better, and they will also recommend you as a conclusion of that. And of course, you can also identify upsell opportunities that can be done by heavy usage, or if someone reached a seat limit, and these things. That could all be health scores as practical examples. Now, what are good health scores? And this is a topic that we, of course, as a customer success company, are confronted every day as we onboard our new customers. And one of the things that we hear in the first sentences, like when we ask, like, okay, what do you have an idea about your health scores? Like 90% of the people say, I want to track logins. As the first thing they come up, I want to track logins. However, the good news, it's okay to track it. However, it's not a very great health score. Why is that? Well, in the end, you have to ask yourself, why do people pay you money? Why do people purchase your product? What's the pain your product solves? And it's almost never to log into your platform, right? It's good to track it. It shows activity, but it's not telling you anything about how much value does your product or your service provide to this particular customer. Same things goes with the average time spent in the application, or how many users do we have. It's all okay to track, but it's not necessarily some key KPIs, some key health scores that are good, and they are really important, because again, nobody buys your product to spend time in your application. That's maybe true for Facebook, where they really want to track how much time you spend there. For all the others, it's I want to solve the pain. I want your product to help me with that. And ideally, actually, the time spent in the application is not that long because the pain is solved fast. What are other good examples? So typically what I do when I onboard a new client, or when our team does that, is we look at the pricing page and we look at the features. Okay, so typically when you have a SaaS company, you have a pricing page, you have a feature page, and these features listed there, they are very good. There are very good chances that those typically tied to the health scores that are relevant for your company. That can be emails sent if your if your tool is sending emails. That can be tasks completed if your tool is somewhat related to a task management system, or uploading files if you're a box or some other kind of solution where I can upload files. I mean, all in all, it's just like tied to the product usage, tied to the pain that you solve. Those are the better health scores and the more important health scores. And another thing I want to touch on is like, why is it important to not just have one health score? In Custify, here you see a screenshot, we call this global health score, is the thing you see there on the top from all those health scores. And why is it not good to just have one? So I know that some people like have in the background some kind of a formula. So if they don't log in, we subtract 5 points. If we do this, we add 10 points. If they use this feature, we add 2 points, and so forth. Okay, then in the end, you end up, you have multiple factors that get calculated in this health scores. However, let's say you look at the customer and it doesn't look that healthy as this one. Like it looks like maybe 50, right? 50%, which is like out of 100, it's just not great. The next question is anyway going to be why? Why is that customer not healthy? Are they not logging in? Are they not sending emails? Are they using any product features and so forth? That's why these multiple health scores, and in Custify we have them all in one view, as you can see here, are a best practice and the way to go. The reason is like I mean, this is not just like our idea. I've talked to about 250 CSMs over the time, and while it's really good to have this global health score or this final health score, which I come to a second, it's much more important to understand which individual things are actually working well with this customer and which are not. NPS score being one of those things, like do you get a good NPS score or not? But most of the other health scores typically are related to data, to usage, to how many tickets they have, or all these other examples about the product usage that I used before. And it's important to see which of the areas are working well and which are not. Why? Because if you talk to this customer, or if you reach out to this customer, or if you have an inbound call even of this customer, or a QBR, or a renewal talk, or these kind of situations, it's important to understand what areas are not working well for this customer, so you can either proactively reach out to them upfront, or you, at least in the call, in the conversation that you have, you know what maybe not to touch or what maybe to touch on because of those individual health scores that you have. And of course, not each health score has the same importance. It's the example from before with the logins. Yes, okay, logins is good to track, and yes, it might have a small importance, but it's not the reason why people pay you money. And the ones that are totally tied to the value that you provide, and of course also an NPS score, which is, I mean, a direct feedback from your customer. It couldn't be more important than that, I guess. Those should be weighted into this equation. And yes, this global health score, this final score, however you want to call it, is still an important thing. And the definition of it is basically that it takes the individual health scores with a weight into account and then comes up with this final score. What can this final score do for you? Well, it gives you a great overview about the relationship with your customer in one view with one number. So if it's 100, you for sure know that this thing goes very well, or 90. If it's 20, then you know most likely a lot of those individual health scores are not looking great. Otherwise, it wouldn't be 20. And it can signal kind of churn risks in time, or it can also be used, of course, for the opposite, like upsell opportunities or identifying customers that you might want to reach out for case studies or for referrals that they might be able to do with you. So we have, to sum up, we have like this individual health scores, and then we have this this global health score that basically takes those into account. But at least from our experience and from our interviews, it's important to see them all at the time to be able to quickly judge whether certain areas are going as they should. Now, how do you create such a health score, and what are the things to take into account? First things first, a health score doesn't have to be available for all the customers. It can just as well be for a subset of customers. Practical examples: if you have a SaaS business and you have 3 different pricing plans, and on your starter plan, not all the features are available, but some of those features that are there are quite important. However, only for the enterprise customers, it wouldn't make sense to track that health score for the starter plans because it's not available, so people can't use it. So it's important to define your segments, your personas, and decide whether or not that is important. Another example is, well, maybe in the onboarding, or in the adoption phase, other health scores are important versus once they are an established customer. So that could be also a segmentation that you do. And then the second step is kind of how important is that, and what's the distribution? What are the settings for that? So what means good, what means bad, right? And then last but not least, yeah, the weight, the importance of that health score. And in Custify, for example, it looks like this. So I can steer this value, so I can see a real-time distribution there across all my customers. How would that health score with my current settings distribute? Am I okay with this, or do I rather want to say, well, no, I just want to have the top 20% to be healthy, or like in this case, there's a large healthy part, and then there's like a smaller part in the bottom that is actually unhealthy. That is something that you, with all your experience, need to decide, and that's something where in the end, really customer success managers and people that know the product can judge. That's why I'm to come back to Miranda before. This is really where customer success knowledge is important. The tool can help you, but you still need this human influence and this human knowledge about what is good, what is not good, and that is a very important part when you set up those health scores. So why are these health scores then important right now? So for sure, your competitors are using them. That's one thing to consider. And if you are using them, you can really deliver a much better customer experience. You know who to talk to and what to talk to about. Imagine yourself, you are a user of a platform, and the customer success team is going to reach out to you and going to say, hey, John, I just checked, but it seems you haven't discovered our new feature yet, and this is how it works, and this is how you can use it. And this is just an amazing experience, because you don't even it's like, wow, these guys really take care of me. They look into the account, they check that. So the customer experience is much better, and you're gonna get also much more qualified discussions if you are in a more higher touch customer success environment where you have QBRs and these things with your customers, because you have all the data there, also the historic data, and you can see how did that go in the entire quarter before you get back to them. Yeah, and I mean, this also is a more process and data based approach. So judging on data, we had this topic in the intro before, is really gonna get important, or is important actually all the time. It was important 10 years ago, it's even more important now. Having more data comes with also this responsibility to use this data and to use it in the right way. So taking decisions based on data is really important and helps your processes. And yeah, as I mentioned already, you can also get more proactive with your customers based on those health scores, depending on your channel. You can email them if you're in a low touch segment of customers and you can't afford to call them. You can still proactively email them. You can add them to campaigns. You can send them educational videos, but you send those guys educational videos that need education, not the ones that already know it. And that's the difference. And the ones that already know it, they might have a lack in a different area of your product, and you directly get in touch with them to explain them that area. So it's a much more qualified and a much more data approached customer success strategy that you can establish with those. Yeah, summing up, to recap quickly, reducing churn and increasing customer lifetime value is something that they will help you with. They will help you to identify promoters, and they will help you to therefore get these promoters that will in the end give you more customers and more recommendations. And of course, they give you guidance on how to talk to your customers and how to deliver them the best possible experience and the best possible service. That's it from my end. If you want to get in touch, here's my email address, or hit me up on LinkedIn. That works as well. And now I'm super curious if we have any questions, and diving into those.
Thanks, Philipp. Yeah, great talk and insights. I mean, most of the customer success people know Net Promoter Score, but I guess they should know customer health score as well, as you mentioned.
Yeah.
And before getting questions, I mean, I would like to learn about what metrics is important for customer success people as customer health score. I mean, can you share other metrics that are important for customer success teams?
You mean besides for the teams themselves, like their metrics? Of course. I mean, their metrics, and again, here it depends a lot on how high touch, low touch you are.
Yeah.
By the way, I'm seeing myself joining again. I'm not sure what that is. I'm hoping I'm still the right one. Yeah, I mean, the other metrics that a customer success team has are typically around, well, their performance, their portfolio health, these kind of things. So typical things that our customers would set up is like the portfolio health of certain customer success managers, right? So what's my health? Or other things are portfolio looks at, for example, renewal customers, right? So what is the, in the end, that is kind of a forecast that you can do. What's the revenue on risk, right? So let's say 6 months before the renewal, you look at those customers very specifically at those health scores and you group them. And the ones that don't have good health scores typically are also most likely on risk to renewal, right? At least those are other metrics that come to mind.
Yeah, thank you for that. So I'm checking the questions if you have any, and Adil asked a question like, what score metrics is a good indicator for potential upsell and cross-sell?
Upsell, cross-sells, absolutely. So this is what I also mentioned there. So upsells and cross-sells, I mean, health scores to put like a positive influence on that. Not always just like discovering problems and the customers that don't adopt your product. It can be very well on the other side as well, meaning it can be that, yeah, these upsells, cross-sells opportunities, or people who will likely be giving you a great review for your website, or be kind of a person that you can use as your lighthouse customer, or that you can introduce to leads that are not sure if they would buy your product. Those are typical also other things that these health scores can be used for.
Yeah, I mean, it's also, I think it's related to their active score, which is related to the usage of the software. If you think in SaaS business, for example.
We do that in Custify. We have this score, and we don't have we do it a little bit more sophisticated. We have a trend. So basically, instead of just like looking at numbers or something, we just look at the trend, right? Activity score is a great example, and you can take several things into account for activity. This depends on your product that you have, but that can be navigation through the menu. That can be notes they leave, comments they leave, these kind of things, clicks somewhere. All in all, that activity shows you that people are active in the product. Still doesn't tell you about the value that they get from your platform, but it shows you they are at least active. And if this goes down, this is typically an alarming signal, because then you really know that, well, people are not coming back to a product, and they cannot even get the value because they're simply not there.
Yeah, definitely. So Sophie has a question like, how do you see the influence of a gut feeling as opposed to hard facts and data?
Very good. We haven't touched on that. I was like purely looking into the data point ones. For example, in Custify, we have this area where you leave your gut feeling, like the sentiment, and this is a very, very important part indeed. So great point. Good that this was brought up. And this can be very contradicting to the other scores. Practical example: you have like the data shows you not great. Let's leave NPS out, but let's say usage data or these kind of things shows you that this customer is not in the best shape. However, you get on a call with a customer and they will tell you, hey, guys, super, we love your product, all good. We are just like this month is very busy for us, so don't worry, right? So in this case, you can leave this personal opinion there, and it's like a very healthy customer, and it basically weights out the other health scores that are based on the data. And unfortunately, also the other way around, they can look very good, and you get to a call and you realize you missed something, or you missed some support problems they had. And these things can, of course, be also the other way around. But very good point, and a very important part in the customer success was, at least for those people who are, let's say, slightly more higher touch and that have touch points to customers. If you're purely tech touch and you never get in touch with your clients, and your only personal way to see it is kind of the NPS score, then it's of course a different story.
Thank you for that, Philipp. And another question, it's related to volume. I mean, the question is like, how would you measure a health score if you don't have a volume? So think that you have 10 customers, what are we going to do? I mean, so do we have a limit of customers that we think that it's necessary to apply customer health score? I mean, maybe minimum 40 customers, 60 customers.
No, we have customers that are extremely high touch. They have 10, 15 extremely high touch customers, only enterprise businesses, and it's perfectly fine to still have health scores because you still have usage. So the question is like, if you have like just a one-page application where, okay, I go there and I have 2 buttons to click, then that would be a lack of data, but not the lack of customers, right? If you talk about AI and learning about this, okay, then it becomes the smaller the data, the more problematic it becomes to do something about it. But other than that, I wouldn't say that the number of customers somehow restricts you to not do health scores, because you still have usage. You can still measure that.
I see. Thanks for that. So we have another question, like, and this is, I guess, our last question because we have 2 minutes left.
Sure.
So how can a senior success manager leverage health scores to maintain good levels for the team?
Yeah, I guess with this average health score, it's meant the global health score. And I mentioned that in the talk. So this is a great indicator that depending on the, let's say, amount of customers that you have in your portfolio, some of our customers have 50, to give you an idea, right? So some of our customers, each CSM handles 50, 30. That's extremely high touch. The other end is 200, 400, 500, where you have much little time. And this global health score, specifically in those cases where you have a large portfolio of customers to handle, can help you to dig deeper into those that you filter by this global health score, and then the ones lower than 80, you have a closer look into them, or lower than 50, you have a closer look at them. But then you can see the individual problems they have, and they might be completely different. So the one might be very good in that area, the other one might be very good in the other area.
Yeah. So we have a minute left. So we have 3 or more questions, but I guess you can, those guys can reach out to you through LinkedIn as well, Philipp.
Yes, for sure.
You didn't share your LinkedIn, and I guess you can share it through chat.
Yep, we'll do that.
Yeah, so thank you, Philipp, again. It's a really enlightening one. I mean, as you said, most of the people do not have any information about a customer health score, but it's one of the rising trends right now. And I think it will be better to apply customer health score for, again, software companies, or again, e-commerce companies, to understand how to get in touch with customers and also users. So thanks for your speech again.
Absolutely welcome. Thanks for having me, guys. Have a great rest of the workshop, and thank you for having me.
Yeah. Have a nice day, Philipp. Thank you.
Thank you.